the steering committee of Livermore Indivisible. It's a pleasure to have you here. Anybody new that's never been with us before today? Well, a special welcome to you and to everyone that's on Zoom for our presentation today to help people figure out the things about Medicare, especially during open enrollment. So not to take too much time, it's my pleasure to introduce Jennifer Pardini, who is with the Legal Assistance for Seniors at HICAP. HICAP stands for Health Insurance Counseling and Advocacy. So she has been with them since July 2017, and she comes from a background of education, and she's certified in HICAP as a counselor. Her department provides free and educational presentations to groups like ours and Medicare beneficiaries, their families, and or providers on a variety of Medicare and health insurance questions. She loves that role. She loves working with the teams in her office and bringing essential information to older adults in Alameda County. So welcome, Jennifer.
Thank you. Thank you very much. Are we able to pull the slides up? Or do you need to be? Got it, okay. So I will briefly just talk a little bit about the agency so you know what services we offer, and then we can talk a lot about Medicare. I like to joke that I'm going to give you a lot of information, so my job is to come out and confuse you so that when you have questions, you call for an appointment. So I will tell you many times today, call us for an appointment. So today's topic is changes for next year. So there's not a lot of, there are some new changes, which is exciting for good days. There's not a lot of changes to Medicare rules, but there are changes in Part C and Part D plans that happen from year to year. So this is the time of year when you can evaluate and make sure you're in the best one for you. You can go ahead and go to the next slide. Our mission at Legal Assistance for Seniors is to ensure the independence and dignity of seniors by protecting their legal rights through counseling, education, and advocacy. I'm out of order. Education, counseling, and advocacy. So we have our legal department. I'll tell you just the legal services we offer. I'm from community ed, and then we have the Medicare counseling available through the HICAP department. And can I just ask, can the people on Zoom hear me okay? If they want to give like a thumbs up or a yes in the chat or a head nod, I just want to make sure before I go too far.
Wait, like no, I can't check it.
Oh, you can't check. Okay. Well, I don't see anyone putting in the chat anything, so I think we're okay. So we can. We are a nonprofit that that's been providing services to older adults now in counties since 1976. You can go to this. So we do help with certain areas of law, specifically government benefits. We don't enroll people in programs, but if you are receiving Social Security, SSI, or the Cash Assistance Program for Immigrants, and you have a problem, you can come to us for help. We also can help renew green cards. And if someone is a legal permanent resident who wants to be a naturalized citizen, we help with that as well. We do elder abuse prevention. As a community educator, I get to come out and talk about what it looks like and ways to remedy it. Our legal staff is able to do things like mediation, restraining orders, connecting older adults with appropriate services to make sure they're in safe situations, and some advanced planning. In caregiver refers to what we call our guardianship program. That is our lowest age threshold. Anyone 50 and over can come to us if they are taking care of someone under the age of 18 and they want to be that person's legal guardian. If they want to have rights with things like school and healthcare, right? We help them with the paperwork, the court process, and everything to help them be that child's legal guardian. Planning for the future. This is where I like to make it very clear we are not a full estate planning office. We do not do things like wills and trusts. We have a presentation on advanced healthcare directives. If you ever want me to come out and talk about it, it's like my favorite thing to talk about. Everyone should have one. Sometimes with our elder abuse clients, we will help them fill out an advanced healthcare directive or durable power of attorney. But again, we don't do the full scope of estate planning. As far as healthcare coverage, the key word is Medicare. If you have Medicare, should have Medicare, had it and lost it for some reason, like no matter what, if the word Medicare is involved, we can help. It can be Medicare and Medi-Cal, Medicare and any other kind of supplement or retiree coverage or anything related to Medicare.
Hello, Karen.
And then Our housing department is small, it's very case by case. If you have a question or issue, please feel free to call us. If it's not something we help with, we do try to refer to another agency that would be able to help.
Hello.
Hello,
Yes.
I hear you. That's it. Oh, somebody's trying to get in too, we can admit them. Oh, yeah. Like, I'm missing all the important Medicare information. Can I move on in here? Go for it. I don't see anything in the chat. If you, okay, as I say, if you can't, well, if you can't hear, you don't hear me saying, put it in the chat. But if there's some other issue, please put that in the chat. Because then it'll pop up and we'll be able to see. Trouble hearing the audio, lots of echo, not enough volume. I'll try standing closer. I just don't want to keep turning my head backwards. So let's see if this helps. I just didn't want anyone else to have just my face. As lovely as it is. Okay, and we can go to. You just go to the next one. There we go. So the important thing about HICAP is that it is objective information. We do not sell insurance products. Our HICAP counselors are educated in all things Medicare. If we don't immediately know the answer, we know where to go find it. And so we will get you answers to your questions. We will not try and sell you any insurance. We do it so people understand their rights and their options. We can go to the next slide. We do get funding from the area agency on aging to run the program. We have counselors that are certified, so they go through extensive training and then they do continuing education to stay up to date with all things Medicare. Prior to COVID, we were in more than 30 locations in person. We are mostly still phone counseling. We do have video, people would prefer video, and also some limited appointments available in person, but they're mostly in our office in Oakland. We do, again, presentation so you know your rights and your options. If it's a difficult case, it may first go to the HICAP counselor as a question. If it turns out there's like an appeal because Medicare is denied coverage for something or any other kind of issue that maybe needs to be elevated, it would then go to our health law department who could take that case. Again, all services are free. So counseling is always free as well as all of our legal services. It is simply based on age, and each program might vary a little. Medicare, most people who have Medicare are 65 and older. Some people are under. As long as they have Medicare, if it's a Medicare problem, we can help. With the other programs, sometimes it's 60 or 62. So there's just different ages, usually based on the legal definition of what something is. But at a point where someone qualifies, there's no cost. We can go to the next slide. So what you really came for, Medicare. It is federal government insurance designed to be for 65 people who are 65 and older, or if you're on Social Security disability insurance under the age of 65, you can qualify. There are no financial eligibility requirements. They're not going to ask you about your income or your assets. You will age into Medicare. The next one. You do need to be a U.S. citizen or legal permanent resident who has been here for at least 5 years. And then again, if you're under 65, you may qualify based on 24 months of Social Security disability income. If you're under 65 and get diagnosed with kidney failure or Lou Gehrig's disease, you don't have to wait 24 months. You get fast tracked into Medicare. You do apply through Social Security. We can't take an application. If someone has questions, we may be able to help them, but ultimately it's Social Security that processes the application into Medicare. Go ahead. There are 4 parts. So there's a whole alphabet, and then we're going to kind of put another alphabet later, but for Medicare, we've got A, B, C, and D. A is the inpatient. So think about it as if you're going to go in and stay, it's going to fall under part A. Okay. B is the outpatient. If you're going to a visit, a doctor visit, a lab, an x-ray, something where you go in, get a service, and move on with your day, that is outpatient, and will be under D. We jump. D is for drugs. So original Medicare, created in the 1960s, was A and B. You could go to the hospital, you could see the doctor. If you didn't feel well and the doctor prescribed something, you could go to the pharmacy. If you could pay for it, you could get it. In the early 2000s, they added Part D drug coverage to help people actually get their prescriptions. Part C plans are Medicare Advantage plans. They take A, B, and almost always drug coverage, that D, and roll it into a network. So if you join a Part C Medicare Advantage plan, You are joining a certain network of doctors and hospitals that you are going to use as part of that plan. A very clear example everyone always understands is Kaiser. If you join Kaiser, you will see the Kaiser doctor at the Kaiser hospital and use the Kaiser pharmacy. In Alameda County, we have many Part C plans available, not just Kaiser. So if you join any of them, you are saying, okay, insurance company that I'm joining, I'm going to see the network of doctors and hospitals that you work with. So we will talk about those quite a bit because they're part of open enrollment. But before we do, we're actually going to review a little bit about A and B coverage. So we can go to the next slide. Oh, everything wants somebody in.
Yeah. That's
Okay. It's very hard to do the in-person and to Zoom. Yeah. All right. I can start talking about it. Okay. So most people, that's okay. Most people get their, oh, is it someone calling in? Oh, it's okay. So most people get their Part A for free. If you've got 40 quarters with Social Security, which is about 10 years of full-time work, you could also earn it over part-time work over more than 10 years. As long as you've got 40 quarters, either through your own work history, a spouse or former spouse, you can qualify for free Part A. It's based on those taxes you paid in while you worked. If someone does not qualify for free Part A, there are two tiers. These are the costs for next year for 2023. If someone has 30 to 39 quarters of history with Social Security, they can buy Part A for $278 a month. If they have 29 or fewer quarters, they can choose to buy Part A for $506 a month next year. That's very expensive. Some people who do not qualify for free Part A will continue to buy something through Covered California. They are allowed to stay in Covered California because of having to buy Part A. Unless someone would have to buy Part A and you turn 65 and you now qualify for Medicare, then you have to go into Medicare. You can't stay in a Covered California plan. So only those who have to buy Part A are allowed to stay if they want to. All right. Should we take whatever was happening in the chat? That's quite long.
No, we're not gonna take that.
Okay.
We shall do the end.
Okay.
Sorry about that.
That's okay. It's just a long one. I was like, uh-oh, are they having trouble? Okay. Okay. We can go to the next slide. Part A covers all the inpatient services. So when I am talking about these few slides of A and B, I'm talking about original Medicare. This is someone who does not have a supplement, no Medigap, no Part C plan, no Medi-Cal, just original Medicare. They have enrolled in A and B. If you are in your Part A and you need to go into the hospital, there is a $1,600 deductible next year. I like examples. I'll use a few today. Let's say I slip and fall and break my hip. I'm going to go in and have hip surgery. I'm going to be in the hospital for a few days. If I only have original Medicare, I have a $1,600 deductible. Yes, it is much less than the cost of hip surgery, but it is still a big cost if I was not planning on it. So this is why a lot of people do supplement their Medicare so that they don't hit some sort of surprise cost when something happens. Oh, that's okay. I know my example anyway. So the first 20 days of skilled care are completely covered by Medicare Part A. Days 21 through 100 have a daily copay. Next year, it'll be $200 a day. So in my example, I've gone to the hospital and had hip surgery. The hospital says, you know, you don't really need to be in the hospital anymore. And I'm like, okay, but I'm really not ready to go home. Maybe I'm not getting in and out of bed very well, or can't get to the bathroom easily by myself. Maybe there's some stairs that make it difficult to get in and out of my house. And so they're going to send me to skilled care. In my example, let's say I do pretty well and I'm only there for 2 weeks before I'm mobile enough to be at home. So 14 days is less than 20. I will not pay anything for skilled care under that because my Part A picks it up. Now I'm at home, but I'm not ready to like hop in the car and drive to physical therapy. So my doctor is going to prescribe me home health, which is fully covered by Part A. No, we're not there. Okay, we could go to the next, or can we go to the next slide? Okay. I'm like, I know them by heart. I can do them in my sleep, but there you go. So home health is covered, meaning if the doctor says Jenny needs the physical therapist to come to her house once or twice a week for maybe an hour at a time, the physical therapist will come to me. We'll probably do some exercises. They'll watch how I'm getting up and down, making sure I'm not going to hurt myself or fall again. And so completely covered as long as I need it. As long as my doctor says I need it, I do not have to be improving. There was a lawsuit won a few years ago that says it can be to maintain or not decline in the function that you do have. They can keep providing a home health at no cost to you. So if you are receiving home health and the agency that you're receiving it through says, oh, you know, we're going to terminate services, and you're like, no, you're not, I still need help. You work with your doctor to have the doctor say they still need this. It will continue to be covered under Part A. If anyone ever has a problem, do not hesitate to call us. We will also help you with that. Completely separate from the hip example is hospice. So hopefully a broken hip does not lead to hospice. If I am terminally ill, let's say a cancer diagnosis, and my choice is to not seek treatment. I'm like, you know what? I don't want to go through chemo. I'm going to go ahead. Whatever's going to happen is going to happen. But I want to be comfortable until that time comes. My doctor can say that I am not expected to live longer than 6 months. It's okay if I do. It's 6 months and a day, they don't come charge me or kick me out. The doctor just has to recertify that it's, again, I'm still terminally ill and not expected to continue a long life. And then A will cover hospice. It's pain management. Hospice programs can provide medical equipment or medical beds you might need at home. They'll have medication brought to the home. Doctors or nurses can come see you at home. It's actually really great care. So great that often people do feel more comfortable and do live longer than 6 months, which is why you can reauthorize. It's okay. But that is all going to fall under Part A. So we can go to the next slide. This is a lot of information on this slide. I'll just say I'm going to break it down. I recognize it's a lot to look at. Most people are going to enroll in Medicare when they're turning 65. It's called your initial enrollment period, and it has a 7-month window. The chart shows the 3 months before your birthday month, and 3 months after. This is where there's a change for next year. It has been that if you enrolled in month 5, 6, or 7 after your birthday month, then it got pushed out when your Medicare would actually start. As of January, anyone who enrolls in month 5, 6, or 7 of their initial enrollment period, their Medicare will now start the month following their enrollment, just like other normal health insurance. So they're not going to have to sit there and wait. So for some reason, someone might not enroll in their initial enrollment period. Hopefully it's not just because they didn't know, but maybe they're still working or has a spouse who's working and they're able to have covered through active employment. They don't need to enroll in A or B if they have other coverage when they're turning 65. Many people do still enroll in Part A because if there's no cost to them, it's just extra hospital insurance, fine. But they may delay their enrollment in Part B because they have other coverage, and why would you pay a premium if you don't need to be paying it yet because you have other coverage, right? Makes sense. So when that person is ready to enroll in Medicare, whether it's because their spouse is retiring and they're going to lose the active coverage, or someone loses their job or the coverage for some reason, they will be in a special enrollment period. They get 8 months from the time that the active work coverage is going to stop. They have 8 months to enroll in Part B with no penalties. It's not on this slide because there's no room for it, but also I hadn't thought about putting it on here, but it's come up as a question at my last couple of presentations, so now I'm just adding in. There is a penalty if someone does not enroll in Part B when they're eligible. So if they just turned 65 but didn't have other coverage and didn't enroll in Medicare, they could possibly have a penalty later. If they don't enroll in that special enrollment period after the work coverage ended, they could end up with a penalty later. The only time you can enroll if you missed the IEP or SEP windows is the general enrollment period, GEP. We love letters. So the general enrollment period is January to March every year. This is where there's also a change. So starting in January, anyone who enrolls during general enrollment period, their coverage will now begin the month following their enrollment. It has been that if they enrolled in that January to March window, didn't matter which month they enrolled in, they had to be all the way till July for coverage to even start. Okay, so that didn't make a lot of sense. They're changing that. It will now make sense that if someone is enrolling, they will earn their coverage that month following. So here is more information about the penalty that's not on there, which is for if you have a 12-month window where you were eligible for Part B and you did not enroll, and then you enroll later, let's say during the general enrollment, for each 12-month window that you didn't enroll when you could have or should have, there's a 10% penalty. So if I miss one of my enrollment periods, but I realize it, get through the general enrollment within that 12-month window, no penalty at all. But once it hits that 12 months, it's going to be a 10% each time it occurs another 12 months. So it's bad to not have coverage. If you have questions or problems, please come see us. In Part B, most people next year will be paying $164.90. That's actually also exciting because last year from 2021 to 2022, it went up quite a bit. It went up almost $22. I think my jaw hit the floor when they released the number. I was like, what are they doing? Naively, I was hopeful maybe they were adding dental and vision in, like the packages. Didn't happen. It comes down to there was an Alzheimer's drug they thought they were going to cover more widely, and then they didn't. So people now basically were overpaying, and so instead of staying the same or even going up for next year, it's actually going down about $6 a month. So I will take it as a win. So most people, also because if someone qualifies for a Medi-Cal or a Medicare savings program, it will pay that premium for them, so they would not be paying it. And on the next slide, we'll see that people who make a lot of money in their retirement will actually pay more for their Medicare. So we'll hold on to that thought. The last part here is just that there is, under original Medicare, remember, no supplement. Under original Medicare, there's a deductible that actually went down $4 from 2022 to 2023 also. So that's going to be a little bit less next year, but that's out of pocket before Part B kicks in. Once Part B is in place, it's Medicare will pay 80% and you have a 20% co-insurance, which again is why a lot of people think about a supplement, because 20% of what? Who knows? Who knows what services I might need in the year? 20% could be nothing or it could be a lot. So this is again original Medicare. So we can go to the next slide. I won't spend a lot of time on it. It says if you fall into either or any of these brackets in retirement of your income, you will pay more monthly for your Part B. It's called an IRMA. If anyone has a question or has an IRMA and they want to talk about it with a counselor, give us a call. Sometimes you've had a life-changing event. They look at your tax return from 2 years ago when they determine this. If 2 years ago you were actively working and now you have retired and you are not making this income, you can actually fill out a form and say, please Medicare, look at my actual income and not my income from 2 years ago, and then they can adjust it. You can go. So Part B is all the outpatient stuff. We said the doctor. It's also going to be things like diagnostic tests, rehabilitation services. I like to make sure we point to durable medical equipment. So it can be prescribed by your doctor. If you need a walker, a wheelchair, an insulin pump, any kind of durable medical equipment, your doctor can prescribe it. Medicare will pay 80%. If you have original Medicare, you have a 20% co-insurance because it's under Part B. Also ambulance rides. I think if anyone knows anything about ambulances, ambulance rides are expensive. And so you step on that ambulance, easily someone's sending you a bill for $2,000. You've got Medicare, great, they're going to pay their 80%. That's still $400 that you have to pay out of that $2,000. So again, it's a lot if you're not planning, right? If you're not expecting to have to pay it. So when you look at supplements, they will fill in these kinds of gaps so that you don't get those costs when you need to use a service. Mental health is covered equal as any kind of physical health appointment. It's covered 80% under Part B. Outpatient, physical, occupational, and speech therapy. If I go to their office, now it's outpatient and I have a co-insurance. When they came to my house under home health, they paid nothing. So if you can show that you are homebound and need services at home, A will pay the 100%. Homebound does not mean bedbound. You don't have to be stuck in bed. It just has to be difficult or unsafe, like risky to your health if you go out and get services outside of the house. Anyone who's immunocompromised, right, has a great argument as to why they need home health during COVID. And if the public health emergency is still in place. So that is currently still a very valid argument. If someone says it's not safe for me to leave the house, I need services. Okay, so as long as it's medically necessary and reasonable, Medicare is going to pay their 80%. We can go to the next slide, which will show us these are some, but not all, preventative benefits. There are many. Lots of cancer screenings, diabetes screening, heart disease. You do get a visit when you're new to Medicare called your Welcome to Medicare visit. And then from then you get an annual wellness visit. Totally free, all of these things. Your doctor just has to say, oh, we should really do this based on whatever concern you have. They can authorize this, Medicare will pay 100%. This shows 4 vaccines: flu, pneumonia, Hep C if you are considered high risk, and COVID-19, all fully covered, 100% preventative Part B. We can go to the next slide and tell you, I'm really excited about this top part. They're adding 2 vaccines to that preventative, the shingles shot and Tdap. So shingles has not been covered under Part B as preventative up until now, meaning they would pay their 80% of a very expensive shot, and you still had a pretty high co-insurance or copay when you went in to get that shingle shot. If you need it, starting in January or after, it's 100% covered. Also, tetanus, diphtheria, and whooping cough will be on that list. Some things that were added in 2022, we've left on the list just so people make sure they know. Bariatric surgery under certain conditions, cognitive assessment and care planning services are covered. Blood-based biomarker tests, again, if you need these things, your provider will know like what makes sense to get for you. Any COVID-related services. And also they've added opioid risk assessment into the wellness and welcome to Medicare visits because we're trying to do a better job. Yeah, lots of things are added, which is good. Nothing got taken away, but here's my least favorite slide. It's all the stuff Medicare doesn't cover. I'm sorry, if it were up to me, I would include more of these things. So routine dental. And when it says routine, think about basically anything in your mouth is not going to be covered by Medicare. Cleanings, cavities, crowns, root canals, any of it is considered routine. There is a very small amount of coverage that sometimes happens. Like let's say you are going to have some other kind of surgery and something in your mouth is going to get in the way of that. Then they might provide some sort of dental care to fix the thing so you can have the procedure you need that Medicare is covering. But basically, don't expect them to cover things in the mouth. Routine vision, hearing, and foot care also, all not covered. So you may be able to get an eye exam, but you can't get glasses or contacts through Medicare. Can't get hearing aids. Under foot care, if you have certain diagnoses, like if I am diabetic and I need my toenails trimmed in office because it's safer and there are a whole lot of reasons, then Medicare will cover that based on my diagnosis. But if I just have Medicare and want a toenail trim, they're not necessarily covering that. So routine foot care also out. No cosmetic surgery. Nothing experimental. So it does have to be proven and effective and tested and all of that. And then personal care at home. And I just like to make sure we really think about what that means. So for Medicare, they cover things that are considered skilled. Usually someone has to have a license, right, to do the kind of care that Medicare is going to cover. Personal care covers all kinds of things that are considered activities of daily living. Things like bathing, toileting, dressing, eating. You don't need a skilled person to do it according to Medicare, therefore it's considered personal and they are not going to pay for it. We have a whole other presentation on hiring a caregiver where we talk about some of the differences. If you ever want us to come back, we're happy to do that as well. But we do talk about some of the things that are considered personal versus skilled, and then the different ways people pay for things. A lot is out of pocket. Some people have long-term care insurance, and if you qualify for Medi-Cal, they do pay for in-home support services. So Medi-Cal does cover personal care. So just like to point that out on the slide. I know it's not our topic today. Okay, we can go to the next one. Part D. So we jump letters here because original Medicare is the A and B, and then drug coverage came along. So people want to make sure they have prescription drug coverage. It is insurance companies that make these plans. They coordinate with Medicare to get approved to be a Medicare drug plan. In California next year, we'll have 26 standalone. 4 of them are benchmark or standard, which I'll talk about on the next slide. The Inflation Reduction Act is capping insulin at $35 a month next year. Also good, yay. Not all drug plans cover every medication. So not all drug plans cover every insulin. So if you are in a drug plan and you are taking the insulin that's on their coverage, it will be capped at $35 a month. If you are taking something that's not on their list, they may not be capping it because it's not on their formulary. So if you are shopping around for the best plan for you and you're taking an insulin, you want to make sure that you're looking for a plan that covers what you're taking, or you may have to change medications. So all of these plans vary in premium, meaning the month you pay, or the amount you pay every month to be in the plan, co-insurance, which you pay when you pick up your medication, and the formulary is the list of drugs that are covered by that plan. So the insurance companies work with the drug manufacturers and say, okay, drug manufacturers, we're going to put you on our list because you're going to give us this great deal. We're only going to pay you this much, right? That's the back end business of it. They do have to offer at least 2 in each category, and they have different pricing tiers. So like a cancer treatment drug might be much more expensive than like a blood pressure drug, right? They all have a pharmacy network. So it's important also when shopping for a plan that you're making sure that you can get your medications where you want to get them. And then they all have a process for exceptions. You are in this plan for the calendar year when you sign up. So if I've entered into the new year and now my doctor puts me on something that's not on the formulary for my plan, I have a right to go to my plan and say, hey plan, we've tried other stuff. This is the medication I need. I know it's not on your list. Will you cover it for me as if it were on the list at the same price for the rest of the year? My plan can review all of that and anything my doctor wants to submit and say, okay, Jenny, for you, we're gonna cover that medication at the regular price for the rest of the calendar year. It is not suddenly available to everyone else who might want it. It is very specifically only based on my request, but I can go to my plan. They can say yes, or they can say no. If you ever find yourself in this situation, our health department is happy to help you fill all that stuff. You're welcome to do it on your own. You do not need an attorney to do this. But if you don't feel well and you're just trying to advocate for the medication you need to feel better, this is a lot to have to do on your own. Please come use us. We're free. Come get help. And then you find a plan using the Medicare Plan Finder tool. It is fabulous. You go on Medicare.gov, you put in what you're taking, how often, and the quantity. I like to describe it as computer science magic happens, and it spits out a list and says, okay, all your medications are covered by this plan at this cost, uses these pharmacies, and I can make a decision based on my medications, what I'm expecting to be taking in the following year. There might be a few different options. Maybe I like a certain company over one, whatever, but I can shop around and make sure I am in the best plan for me. Because their formularies can change from year to year, just because you were in a good plan for you this year does not mean that that plan will still be the best plan for next year. So it is really good to check this every year, even if your plan has worked fine for you so far. If you don't want to do this, if you don't like going on the computer, if you don't want to do this yourself, you can call and a HICAP counselor will run everything for you, give you the information. Entirely up to you if you switch your plan or don't, but we can help at least so you know what the answers are. You can go to the next one. It is currently open enrollment. You have until December 7th. You can select the plan up until 11:59 p.m. on December 7th. As long as you've got your plan by then, you'll be in it starting on January 1st. To enroll in a plan, you either can do it through the Medicare.gov website or directly with the insurance company that's selling the plan you want. There is, again, a penalty. This is a different formula, kind of weird one. There's a penalty if you don't have Part D drug coverage or any kind of prescription coverage when you were eligible to have it through Medicare. So you could still have it through an active employer or a spouse's active employment. That's fine as long as the plan is what Medicare calls creditable. You can check through HR or whoever handles benefits at where you work to find out that the plan is creditable. They should be able to provide that information. If you were eligible for Part D drug coverage and didn't have it and had no other creditable coverage, the penalty will be 1% of the national average cost of a drug plan. Next year, that cost is $34.71. So 1% of that for every month that you didn't have coverage. Sounds very complicated. So forever, yes. So here's my example. I turned 65 and I think to myself, I'm not taking any medication. Why should I pay a premium for something I'm not using, right? I don't want to join a plan and I don't know there's going to be a penalty. So I'm like, I'll just wait. And I make it a good 5 years. And at age 70, my doctor's like, yeah, your blood pressure's a little high. I'm going to put you on something. So I'm like, okay, I guess I'll go get a drug plan. And now I go to get one. And find out because I didn't have coverage for 5 years, that is times 12 months. So 60 months, now it's going to be 60% of this average. I'm going to have to pay that as a penalty every month on top of whatever plan I joined. So you guys, I'm not a mathematician, so I just try to make it easy and say 60% of this is roughly $25. So if I have a $25 penalty and I just joined a national average cost plan, I am not going to be paying $35 a month. I am going to be paying $60 a month because it's this plus my penalty every month for the rest of my life. Yeah, it's a lot. Now, there's a little bit of a math gamble. If I only live to 72, I may now better. I did not. So not necessarily a gamble I'm willing to take. So if anyone has a penalty and they want to come see if there's anything that can be done about it, again, please call the counselor to evaluate that. If you qualify for the extra help program, that will eliminate the penalty. You do have to have certain income and asset requirements that are low to meet that, but it will make it go away. And there's some other ways you can look at things, but essentially, if you don't have coverage for a long time, or any amount of time, 1% for every month that you didn't have it. So we can go to the next slide. I said that there's 4 of the standard or benchmark plan. This is the minimum requirement a plan had to meet to be a drug plan in Medicare for next year. They cannot have a deductible of more than $505. The enhanced, those other 22 plans, maybe they have no deductible or a less than $500 deductible. but no plan can be more than 505. If you have a deductible, once your deductible is met, you move into initial coverage. On a standard plan, the plan covers 75%, you have 25% co-insurance. Again, an enhanced plan might offer a little better, maybe they cover 80%, right? So this is why we shop around on that plan finder to look at our options. In initial coverage, if the amount of money spent on your medication with what you put in plus what the insurance company is putting in, so this whole thing reaches the level of $4,660, you're going to move out of initial coverage and into the gap, or what was formerly known as the donut hole. Okay, this used to be very bad. This was the period at which your insurance just stopped paying. They were like, you can pay all of your own for a whole period of time, and if it gets really, really bad, we'll come back in. So you were in this period where it was 100% out of pocket. But with the Affordable Care Act starting in 2010 and working through 2020, a little bit of the gap closed by percentage each year. And so since 2020, it now maintains basically 25-75. In a generic, the insurance company is still paying 75%. In a brand, the insurance company is paying less, and it's the drug manufacturers who are subsidizing on the back end here. Your cost leveled out, so you're not paying 100%, you're still only paying 25. However, it can vary a little bit from this period because the pharmacy can charge a dispensing fee. And in this period, your insurance is covering it, and in this period you are. So it might vary a little bit, hopefully not a huge jumping cost. If you have a question or problem, call us. And then if your drug costs get very high for the year, like you're on some serious medications, or if you take a lot of medication, and you've reached the level where you've now paid $7,400 out of pocket, your insurance company comes back in and says, okay, you're in catastrophic coverage. You will now only pay 5%. It's a very small amount you will pay when you pick up your medications. The insurance company and the government are paying the rest of it. So if this happens, this is the calendar year. So someone on a lot of medications might hit this in June, they might hit it in December, right? Someone may never hit it at all. January rolls around, you start at zero, everything starts over. So that's why we shop around during this open enrollment period to make sure we're in good plans that are going to help us with our medications through the years as best as we can predict, right? You never know if you're going to end up on something new. Okay, we can go to the next one. That clock doesn't seem right, so I'm just going to check on the time. Okay. So extra help, as I mentioned, it helps pay these costs. It's based on income and assets. When we say assets, it does not count the value of one home or one car, right? In the Bay Area, you're easily past that at the value of a home, sometimes the value of a car. So they're really looking at money in the bank. If someone meets these qualifications, this program will help pay their premiums, deductibles, and copays. If they choose a standard plan, it's going to pay the whole premium. If they want an enhanced plan, because maybe a standard didn't cover something they were taking and they want to choose a different plan, this will at least pay a portion of the premium. Then they don't have to worry about the donut hole, and they get a special benefit where you can change your plan once per quarter in the first 9 months of the year, which helps if my medications change during the year. So if I'm on this plan, I may not have to get an exemption request. I may just change plans. You can apply through Social Security for this. A counselor can also help apply for this. We can go to the next one. We supplement Medicare in a variety of ways. We'll talk about Medigap very briefly. We will talk a bit more about the Part C plans. We will not talk about employer, TRICARE, or VA benefits specifically today. We do have answers if you have questions. We're just saving time. And then I'll talk a little bit about Medi-Cal and Medicare savings programs at the end. So we can move into who we're heading towards supplements. We can go to the next part is Medicaps. Okay. Oh, there's one slide before the Medicaps. I kept saying original Medicare, meaning you go, you get a service, Medicare gets billed, they're going to pay their portion. If I do have a supplement, it's going to be that Medicare gets billed first, the supplement may come in second, or it might be that if I'm in a Part C plan, I'm paying a copay instead of a percentage. If there's anything left to be billed, then that will come to me. So let's talk Medicaps. Yes, please. These are sold by insurance companies. They are standardized. They also, I remember I told you earlier, we come back to letters. These also use letters, and the letters have nothing to do with the Medicare ABCD letters. So they go like A through N. If you get a Medicare A, it doesn't mean it helps with your A. It's going to help with more than just your A. It's just the most basic plan, so it's going to fill in less gaps than like a G is very comprehensive. Okay, so these policies pay after Medicare. I'm going to go, I speak the standardized. Does not matter what company you buy it from. If you buy a letter, that letter covers all the same gaps no matter who you're paying for it. So what's the difference? Probably the price they're gonna charge you for being in their plan. Again, you're not getting anything more for the higher price, but they might say, oh, brand name recognition, AARP is great, or we pay claims really fast. Well, it doesn't matter to you, that matters more to the doctor, but okay. So they're still getting paid either way, right? So this policy is going to pay after Medicare pays, meaning if I go see the doctor says the visit costs $100, Medicare is going to pay their $80, supplement's going to pay their $20. I'm not going to get a bill. That's because I pay a premium every month to these people, so I don't see bills. They're dancing. There's no network restrictions. That is why some people like this path or this option, is that it's going to work with your Medicare. You can go see whoever you want, as long as they can bill Medicare first, the Medigap will pay second. So if I don't feel well and I want to go to Stanford and see someone, my Medicare will get billed first, my Medigap will get billed second. I don't see a bill, but I don't like what they said. So I want to go to UCSF and see someone else. Okay, same thing. Doesn't matter. Medicare is going to pay first, the Medigap is going to pay second. I can go wherever I want. The doctor can see me, bill Medicare, Medigap. There is a guarantee issue period for the first 6 months from when your Part B starts. Guarantee issue means there's no health underwriting. Plan has to take you, regardless of any health history or anything else. If you are not in the guaranteed issue period, you can always apply to a Medigap, and the insurance company is going to ask you health questions, maybe take a couple tests. They're going to look at your health history. Basically, they're trying to decide if you seem expensive. And then if you seem expensive, they're not going to want to insure you, and they're going to say no. But just because one company says no, remember there's a bunch of companies selling these plans. So you can shop around. Someone else may take you. Maybe AARP didn't, but maybe MetLife will, right? So you shop around. You can get them outside of guaranteed issue times. Depending, that is what we'll say. Any company that wants to offer any of the letters does have to offer A, which is the most basic package. But again, there's a variety of levels based on those letters for the kind of coverage you're going to get for what we pay. Okay, we can go to Part C plans. I like to talk about the back end stuff. So insurance companies also sell Part C plans. They put a package together and they say, hey, Medicare, for every person that joins our plan, you are going to give us X amount of dollars, whether that person sees the doctor or doesn't see the doctor. Every month you're giving us income because we have someone signed up. Medicare says, haha, that's a fixed cost. I don't get surprise hip replacement bills. Sure, I'm going to pay you a fixed cost and you're going to manage all the services. Great. The plan is like, that is guaranteed income, right? Whether or not someone comes in, we know we've got money, so we can manage all the care for all the people in our plans. Sometimes this is a great option. This is not the greatest option for everyone. That's why you have choices during open enrollment. You are going to be in a network if you join one of these plans, meaning you can't go all over town, seeing whoever you want. You are going to see who the plan allows. They vary by cost, they can change from year to year as well. So that's why it's good to shop around. You want to make sure that if you have doctors you like and you're going to join a Part C Medicare Advantage plan, that you join one that your doctor is part of. Otherwise, you're going to have to change. And they are county by county. So I have information on all the ones in Alameda County. If someone lived in Contra Costa, they'd want to look at the plans available in Contra Costa. We can go to the next one. It's also currently open enrollment. You start it in the calendar year. You have a special option if you start the year in a plan and you decide you don't like it, you have until March 31st to get out of it. You can go to any other Part C plan available in the county, or you can go back to original Medicare, which is fine. But if you're going back to original Medicare, think about if you're going to try and qualify for a Medigap or some other kind of supplement, because again, otherwise you've got all those deductibles and copays built into original Medicare. Most people, if they're going to change, usually only change that once a year, but you do have a right to change during that beginning of part of the year. You do have to have Part A and Part B to enroll in Part C. It used to be that if you had kidney failure, you couldn't enroll in Part C, but now you can. So we put that in there. And also most of these include drug coverage, but not all. So we'll point out which ones don't. So we can go to the next slide. In Alameda County, we have 3 kinds of Part C plans. We have HMOs, PPOs, and special need plans. We can go to the next slide. I have quite a few slides of just, these are a list of plans. I'm not going to read them all to you, but I'll tell you what's important and what you can look for on the charts if you're thinking about one of these. It's going to tell you the name of the insurance company selling this plan. Most of them sell more than one plan. So then you also have to look at which plan am I looking at. Does it have a premium? Many of them have no premium. Why? Because Medicare is gonna pay them as long as you join. So they want your business. They're like, join us for free. We're not gonna charge you anymore. And then they're also gonna probably throw some extra benefits at you because they want your business. So on the chart, you can see what any company is offering as extra benefits. Often it includes coverage for glasses, some hearing aid coverage, usually not in the full amount because hearing aids are very expensive, but they'll cover some portion of it. Sometimes they're offering rides to appointments or meals if you've had surgery and then have to go home. They'll deliver, 2 weeks worth of 2 meals a day. Again, it's because they want you to join. So for some people, it's great. These are great benefits. It's going to make sense. For other people, they don't want to be in a network. They want to stick with the original path. Both are fine options. Everyone's healthcare choices are different. The ones that say no RX coverage, you will notice often have very patriotic names. It's because if you have a service connection to the VA and get your medications through the VA, okay, you will not need drug coverage. You have creditable coverage through the VA, so you can join one of these plans and it's fine. If you don't have creditable drug coverage somewhere else, do not join a plan that says no RX, or you'll have a penalty later. We can just one last slide. Sometimes there's a price and a zero. If you anyone with Medicare can join it and pay a price. If you have Medi-Cal, you'll pay zero. If you don't have Medi-Cal, you will pay that price, and a lot of the co-pays mirror original Medicare, so it's not a great plan for someone who doesn't have Medicare. But if you have Medi-Cal, you also qualify for special need plans, which go through an expert process. So these exist, and we won't ever tell you what to do, but they may not be the greatest option. So you just want to really think about these mirror ones. Okay, there's 2 more slides of it. These are just the names of all the plans. They're on the charts at the back table. You can compare side by side each insurance company. At the bottom of the chart, the most important thing is it tells you the network of doctors and hospitals in that plan. If you don't want to lose your doctor, make sure you stick with one that's in that plan. You can go to the next one. This is just the rest of them. And then we'll go one more slide to the special needs plans. There are 3 types. There's also a chart back there with all the special needs plans. C is chronic. If you have certain chronic conditions like dementia or cardiovascular disorder or diabetes, you can choose a plan that will help focus more specifically around those medical needs. That's a CSIN. D is dual, meaning you have Medicare and Medi-Cal. They offer you a ton of extra benefits. These ones have gone through the process to become dual special needs plans. If you are dually eligible, one of these may be a better option than those mirror ones. And I is institutional. Someone's in a nursing home and they want their Medicare focused around their needs from being in a nursing home, but also needing medical care outside of there. They might choose one that's going to coordinate that as an ISIN. Next page. These are the rest of them. There's no PACE plans in the Tri-Valley. PACE plans are probably not a great option for someone here because you'd have to go all the way to San Leandro just to get all your medical care if you join a PACE plan. So it's not usually a practical option out here. Medi-Cal looks at income and assets. I won't spend a lot of time on Medi-Cal. I will highlight this right here. For the last more than 30 years, maybe 35, it has been $2,000 for an individual and $3,000 for a couple as an maximum. As of July 1st of this year, it went up to $130,000 for an individual and $195,000 for a couple. So for anyone who's low income, who couldn't get into Medi-Cal before because they had a little money put away, they should, if they have a plan before, but think now I might qualify, reapply, because it works as a supplement with Medicare, but also, I told you earlier, Medi-Cal pays for in-home support services. So if someone does need help with personal care, apply, because this is a huge change. And someone may be able to get someone coming in, helping with those basic things that they need to be able to stay at home instead of having to go into institutional care. You can go to the next one. If you had to pay for Part A, this is the one plan that looks at your income and assets and will decide they will pay it for you. So if you qualify for this and you want to get Part A, which you don't have to pay $506 a month for it, okay, apply here. We can help with all of this if you come and see a counselor. And I know we need to move along, so I'm going to skip the last bit of slides. It's like Medicare fraud is bad. Call us if you have questions. We can help. But we can go to that. We can skip ahead like 4 or 5 slides to the very end. Now, resources are on the table, and the last one. One more. There we go. Call us if you need help. Our office is the 510 number, but that 800 number is statewide. So anyone anywhere who needs help with their Medicare can call the 800 number. It will route them to their local county's HICAP. If you're later on talking to your cousin in San Diego and they're like, too many Medicare commercials, you're like, call the 800 number. It'll send them to their HICAP. So we are there. We are happy to do help for anything you have questions with. I am going to stick around. I will take questions afterwards. Definitely want to make sure you all have time for your election updates. I will sit down and I will come back up when you're ready.
And there's one question in the chat. So in the past 3 years, I have been able to get an Excel spreadsheet comparing benefits between the different Medicare Advantage plans.
Yes, it's on the back table, but it's also available on our website.
Okay.
Right here.
Yeah.
Yeah.
That was the easy question.
Yes, you can get the chart on our website.
Oh.
And then send to the nursing facility. The Medicare does not pay for the nursing facility because he was not in the hospital for.
3 days.
Yes.
Yeah.
With the,
So, since COVID, that is waived. So if it's been since March of 2020, okay, if it was prior to March of 2020, there is this whole thing about 3 day and you have to be considered inpatient. You can't be there under observation. So even if you spent 2 days under observation and then you get admitted and it's only 1 day and they send you, they're like, that wasn't 3 days. There's a lot of argument and legislation happening right now to change that whole observation status because it's unfair for them to keep someone there and say, oh, but you weren't really admitted. We were just keeping an eye on you. So technically on his example, it was correct when they did it. It's not fair, but it was correct. Yeah. Yeah. So currently, yes, you would. And when the public health emergency ends, they may keep it the rule or they may change it and we don't know which one it will be yet. So it may go back to how it was or it may stay the same because they'll realize this was actually more effective and it's stupid to keep people in the hospital if they are ready to move and it's simply about the cost.
I agree.
Yeah. Yeah. So, and then because of COVID and hospitals being overwhelmed, they didn't want to keep people there. They didn't need to be there. So it made sense to say, okay, we're going to move you. And we're still going to cover it. So it's a great question. And unfortunately, in his example, it was correct under their rules at the time. Yeah. Yes. Yes.
And is that a similar kind of penalty as one with respect?
So they're different formulas. The part B is based on that 12 months. If you have 12 months where you had no active employer coverage, hadn't signed up for Medicare, but you were eligible and had no other kind of coverage, right? Then for that, each of that 12 months, it's going to be an additional 10%. So if someone had their initial enrollment period, but they were still working, so they didn't use their initial enrollment period, and then they retire, but they didn't realize they only had 8 months to sign up. So let's say they missed the 8 month, and on month 9, they go, oh no, I was supposed to sign up. But they're lucky enough that maybe month 9 fell in January. Now, under the new rule, if they enroll in January, the coverage will start in February. Technically, that would be 10 months, but not 12, no penalty. It's weird. I know it's mad. So, but if it was more than 12 months, let's say they retired and didn't need healthcare for some reason for a year, or what happens a lot? Cobra. Cobra is not active employment coverage. So you think, oh, I'm covered because I have Cobra. I'll just enroll when my Cobra ends. And then they go to enroll and it was more than 12 months that they should have had Part B, but didn't enroll. And because they kept the Cobra coverage, they're going to have a 10% penalty when they go to enroll.
Now, is that 10% every month for the rest of your life?
It's a 10%. Yeah. So you pay your Part B premium monthly. So it's a 10% of that as a penalty for every month for the rest of your life. But if you miss more than 12 months and it gets all the way to 24 months, that's 2 12-month periods or a 20% penalty, right? So for every 12-month cycle that you miss, it's an additional 10%. Yeah. So it's a lot. It's free for most people, so yeah, there shouldn't be a penalty because it's a zero, so. But if you miss it, you have to enroll only during the general. Which then also made people have to wait till July, but now it won't, which is good. Yes.
Penalties are so grossly unfair, especially for people with limited income.
Yes.
And I can understand paying penalty until you made up what you would have paid.
Right.
For the insurance cost that you missed.
Yes.
But for the life.
Yeah. It is ridiculous. The best people to have conversations with about that are the legislators who make the rules. Because I agree. Yes, writing letters, making phone calls, these are the best ways to get that heard. Because, and I mean, while you're on it, if you also want to talk about that vision coverage, I encourage you to make big and known. Your teeth and your eyes are part of your body.
Any more questions?
Yeah, there's one question. Why do so many doctors don't want medical?
Because Medi-Cal reimburses at a lower rate than Medicare. So I'm sorry, quick example, that $100 doctor visit where Medicare paid 80%. If you have Medi-Cal under your supplement, there's still $20 owed. So then the doctor goes to bill Medi-Cal and Medi-Cal says, actually, doctor, we think that visit was only worth $70. And since Medicare already paid you 80, we see it as you getting paid and we're not paying you another 20. Right? Then I'm sure on the back end of things, there's taxes and things that the doctor can do, but that's kind of a pain. And so this is why providers have to choose if they're going to take Medi-Cal. And then if they do, they have to accept the Medi-Cal reimbursement rate, which could mean not getting paid more for their full, like the full payment of their service. So it's harder to find the providers that take both. If someone has Medicare and Medi-Cal, they may want to look at those special need plans. Because if you join one, you are in a network of doctors, meaning there's a provider in that network that has to take you and accept the reimbursement rate. However, if they don't want to be in a network and just want to keep their Medi-Cal as fee for service, they have an absolute right to do it that way as well. It just means you have to find your providers. Yeah. It was a good question.
Well, that concludes your wonderful presentation. Thank you so much. Let's get Jennifer. And the resources to go, back to, there's a bunch of information that she has brought on the back table. If you would like to take, whenever you think would benefit you.
And I'll stick around.
That would be wonderful.
And then if there's questions that pop in your head before we end, they can come to me.
Thank you. Thank you. Okay, so thanks so much. I appreciate the staying. Next about a brief sort of rundown of the election results. We realize it's only been 3 days and things are still happening. So we can only talk about what we know today. So we're breaking this down by categories. So first today we have the federal elections, which I think Kyoko is going to cover. So Kyoko, are you ready? Almost. Okay, great. Thank you. Just while she's coming with you, the national results, and then after that, propositions, and then the city council election, and then the school board election.
So yesterday it got cold, so we know then it's kept the US Senate majority. Woohoo! But really kind of close call, especially Nevada was nail biter. But currently we have 50 seats, and one more seat is up in the air. That is Georgia, because they require the winner to have over 50%. The same thing is in Alaska. So those two are actually not called yet, but in Alaska, there's no way Dems gonna win. So it's already in the bank. That's why the only one seat over there is gray. That's Georgia. That's December 6th is their run-off day. And Helen's gonna have some asks about that. But that's yesterday's news. Let's go to the next one. So even the media started to cover the house races more, which is a little bit more complicated, especially it's not really cold, especially like in California, there are still 10 races. We are not calling it. But for the majority part, they are expecting 260 Dem seats, 219 Republican seats, and 4 seats are still, they don't really know. That's what they are calling. But before we going into this midterm election, we were expecting, well, actually they were expecting to lose a lot of seats. So this was really a good thing. And it's kind of weird that the media is not talking about anything on the ground, what really changed since 2017. But that's a long discussion, so I'm not gonna go there. Next one. So the key and court races outside of California, Colorado, Washington, AZ1, that's actually right now a little bit up, and I think it's gonna go to Devin Hodge, so we are gonna actually keep that one. Alaska is probably gonna win because we already did this for the special election. And they actually have to go to 50%, and it goes to the ranked choice. So the vote is already done, but November 27, I think, they're gonna actually do the calculation for the ranked choice for both Senate and that seat, because I don't think she's gonna go to the 50%. Yeah, well, I'll speak bigger. Yeah, just come closer and go to next slide. And California is battleground. We have, actually they said 11, but we do actually have one already called CA40, and that was actually one of the flip sheets one, so we lost that one. As of now, the most likely column is the one how much ballots are counted. It's not 100% accurate, but that this is from the New York Times, and they get more information than us. So we believe that. So far, share 9, 47, 49, those are all incumbent. So we need to protect them. They are up. And in California, oops. Most of the, yeah, I got it here. So far, we know the later ballots are more towards the Dems. So we are expecting or crossing fingers, they hold. So that actually leaves close one, it's CA13, Adam Gray, 84 votes down. CA22, Rudy Salas is 2,868 votes. Also, CA41, Lawrence is 1,598 votes. So those are still really close races. So we are all hoping to win. So Rudy Salas, CA22 is already doing the ballot curing because these are the not really highly educated voters. So it's more like the Dem voters has problem completing the signature or dates and stuff like that. So by curing the ballots, in 2018, TJ Post came back and won by like 200 votes. So this is important ones. Actually, we need to work on it. So they started to work on it, but right now, Arizona and Nevada is more important because their ballot carrying period is much shorter versus California goes through until December 15th. So those three we're really hoping to win, and rest of them will be much more difficult because even though they have still a lot of votes to come in, over 10,000 votes, deficit is hard to recover. So we will know more. Their next, actually the statewide, different counties are reporting different ways. So we don't know the next really update. The big one will be the tomorrow night. But we just don't know how soon each county will actually finish the counting. Next slide. So what media hasn't really started to talk about is the state control. So Democratic Party actually did really well this year. So all these programs started back in 2010. We lost big time in state races. And as you may noticed recently, they are the ones who control how to vote, how to count the vote, all the voting regulations are state by state, as well as redistricting. So 2010, every 10 years, census count the number of the people. And 2011, after the big win, Republican Party did the heck of gerrymandering. And that was exactly why we couldn't win, even though the Democratic Party, Democrats are more people in the district, but when they gerrymandered, we couldn't win. So that created this 10 years of struggle of the Democrats. After the 2017 election, there are different organizations just realized without fixing that, we cannot win another 10 years. And that will be just so awful. So sister districts started to focus on the state races. Organizing for Action later became the All on the Line, led by the National Redistricting Democratic Redistricting Commission, led by the Eric Holder, former AG. They have been working on each state to fix the problem. So after the current redistricting last year, there are still a couple of states struggling to actually do that right redistricting, but for the most part, we fixed a lot of states, and that results came in through here. So the Arizona has been under the Republican trifecta for years and years, and we are still trying to get them back. It seems like we couldn't take it back this year either. But if we actually have the Katie Hobbs as a governor, trifecta will be broken, so they cannot just pass stupid laws. There have been so many different ways to do this, but voter suppression, abortion rights, everything last year, Arizona has been awful, and now we can stop it. So that's a good thing. Nevada, on the other hand, we have had a Democratic trifecta, but governor is struggling to win, and I think they're expecting the Republicans to win, so we lost the trifecta. That is a kind of big loss for California because we really would like to have our neighbor states to be blue, so we can be protected. That's the real deal. But the rest of the country actually did very good. So the Colorado, Maine, Oregon, Washington, those are the trifecta, then trifecta, and they have been the target by the Republicans, but they held trifecta. Michigan and Minnesota actually turned blue for both legislation chambers. So now we actually have the then trifecta. So next 2 years at least, they can actually say better so they can fix the voting suppression and so forth, because I really wish they actually do that, so they can keep winning. And other states like Florida and Texas, we vote them completely, but still the congressional and state chambers, each district, they have been a very significant wins. First Native, first Latina, first LGBTQ elected officials, they popped up a lot this year, even in those LGBT-led states. So there is hope. And New Hampshire, North Carolina, and Wisconsin, they were going into the supermajority to overcome the governor's veto power, but we managed to actually avoid that. So this was really a good year for them. And the reason for that is UNDCC, which is a state legislative election commission, just realized how important it is, and they convinced all the states to kind of rebalance the donations and budget, so the red or the purple districts actually get more money. And when you talk about money, the lower places, we can actually put a little bit of money and change the outcome. So that was a good strategy and it worked. Next one.
Okay.
Actually, the next one is going to be the propositions. But
I'm sorry.
Listen to that.
Can I ask a question? Yes. Okay, for, I don't know if this is all my, but do you have any idea why Susan left and is looking not so good for governor in Nevada?
He actually had a scandal and he hasn't recovered this. I don't remember what it was, but that was actually, yeah, there was a scandal.
Oh, darn.
Yeah.
And in good state, sometimes that counts. What can I say? But I actually volunteered to take this because I thought this is gonna be really easy. Well, that's a Terry Wiley and Pamela Price, we're duking it out. Wiley is ahead right now. By 5,500 votes. Who knows what's going to happen if the common understanding that same day votes tend to lean more conservative. And those are the ones that have been counted. Pamela Price could get a lot more in the future because she's definitely viewed as much more progressive than Terry is. So who knows who's going to be our new DA? I don't know. Okay, city of Livermore. The mayor, Marshawn and Knopp. The first night, Marshawn was up by 4 with the first ballot jump. Was up by 14 points. And then the next time we got ballots, Moni was up by, I believe, 200 maybe. And then the last time, which was Friday, now Marshawn is up again by 14. So
hello, we can't see the screen on Zoom. We can't see the screen and we can't really see the speaker.
oh, they said, I think I was standing in front of the camera.
Yeah.
Is that right now? Okay. Anyway, so who knows? They're going to start, we're going to start getting a ballot drop at 5 o'clock every afternoon, beginning tomorrow, and we'll see what happens. For District 1.
Oh, wait a minute.
It's just gone away. Anyway, I can talk, yeah.
You have any idea, or is there any way of knowing how many votes are outstanding on the mayor's race in the county?
Well, you know how many voters there are, which is around 90,000, you said? 60?
Population is
It's not,
under 90,000, the voters are roughly 60.
so a lot.
per district.
There's a lot out there.
Okay, and it seems like the folks that have been submitted counted so far, was, what was it like? 22%.
It's 15,000 approximately.
Yes, it was 22% was counted.
Yeah. So there's a lot of votes out there still. Anyway, so Branning, Evan has District 1, which is around 15,000. Both districts are around 15,000 voters. Branning has 1,685. War has 1,226, which is Branning is at 57.88 and Carroll is at 42.12%. So right now, Evan has a large lead, but again, it's a very small amount of voters. In District 2, same number, about 15,000. Then Berriontos has 1,900 and Mel has 1,441, which is percentage-wise is 56.87 to 43.13. The interesting thing about it, and I did this math in my head, and then I didn't believe it, and so I did it on a calculator. They are both 459 points apart. Evan and Carroll are both 459 votes between them. Ben and Mel are 459 votes between. I mean, you can't make this stuff up. That is just bizarre. Anyway, so that's all me.
So for the record, we are expecting to have about 6,000 votes to be the winning number for the district.
So we still got a ways to go. So sort of anything can happen.
Mayor is up in there. It used to be like 20,000 votes. So we don't know the turnout. That's a problem.
Oh, and as Kyoko said, I think everybody in here already has postcards. Some of you got a lot of postcards. But if anyone would like postcards, they were heading towards Georgia because I personally cannot envision Herschel Walker in our Senate. I can't remember he should not be in our Senate. It's been reasonably recent. Some of the houses is totally off the wall. But no, I haven't seen him try to carry the gun into the house yet, or the Senate. I mean, you know, here we go. I mean, so anyway, so if you would like postcards, we're gonna do postcards that will go towards making people aware, because the other thing Georgia is doing, they're very sneaky. They don't have much information about the runoff on their website, on the Georgia election website. So the point is to get people to know, yes, there is a runoff. Last night, they didn't even know where to vote. And I mean, it's a month away.
That's rather they are not allowing during vote Saturday before the runoff.
Because it's a Monday.
2 days after the Georgia holiday, it used to be Robert E. Lee's birthday.
But actually, when you read when the runoff, so when voting starts, and I read this on their website, if you bring this up. It's the fourth Monday after the race, after the election, or the fourth Monday after election is the day before. the actual runoff date. So it's Monday runoff day, it's Monday the 5th, runoff day is the 6th. So, but they just, you know, there's so many they don't even know. And given that a lot of these people are not tuned into electronics the way we are, Facebook, et cetera, getting news that way, it doesn't help the people we would like to vote to have a large turnout. That's why we're sending them postcards and say, hey guys, you gotta get out there and vote. Okay, I'm finished. Joanne, I think. If everybody gets a shot. All right. Anyway. Thank you. Okay, so in the school board race, there were 9 candidates running for 3 seats. There was one candidate, who spent a whole lot of money. She had signs everywhere. Her husband owns a couple of businesses in downtown, and they used everything at their disposal to try to get her elected. So far, she is 966 votes behind Stephen Drummond. So we have Emily Crusoe with 7,694. That's 19.20% of the vote. Frank Bueno with 7,170. He's at 17.9%. And Steve Druin with 6,037 votes, and he's at 15.06%. Kaplanis is next with 12.65%, and then Ann White, who came in late to the race and really didn't run much of a campaign at all, which I don't think she ever has, but in the past, in getting comment, it has been enough to get her elected. And unfortunately for her, it didn't work for her. So we have a card that we're going to give her at the school board meeting, because she has served a good many years on the school board. And it has been a really steady voice, a little more conservative, but a very steady voice. And she's always been very dedicated to the students, so we appreciate her service. Mary.
I heard that there were 39 years, is that correct?
Something like that. Yeah, yeah. I'm not sure. To follow up and get her history, because I'm going to speak at the school board meeting. So, anybody who wants to comment would be really nice, I think. So, anyway, that's where we are. There are more votes to come in, as we know. We think they're going to be leaning more progressive, so we feel fairly confident, cautiously optimistic, that the 3 top vote getters will remain in those seats. So, any questions? Yeah.
Just a trivia comment. I have in my cell phone a video of Izarba's speechifying in front of a MAGA press parade with a Confederate flag in front of them.
Yeah, and you know, I wrote a letter to the Independent about Dina Kaplanis, because a lot of people don't know much or didn't know much about her being a chiropractor, Dr. Kaplanis, and trying to put on a very moderate front, but her Facebook links went to some really bizarre right-wing white nationalist organizations, and so I'm trying to expose some of those with a letter to the Independent, and I don't know if that made any difference. I don't know why she hasn't done better. She has with the budget. hopefully people don't want this to be really. And
I also learned that Thomas and Izzy in our eyes,
it's around.
in our eyes, and this is in there. And springtime, and both are administrative.
That's nice. I don't want to say anything about people's faith or.
No, it's a great.
But, yeah. Think that way, was honest, especially, has spoken, you know, at the school board meetings, and she's very ultra conservative about education. Which is a problem, she's very biased against minorities and, opposed to the full sexualization of students, by informing them about LGBTQ matters. So that's where we're at. Any comments? All right, thank you.
Mary,
Okay. Well, I have a fair amount of research here, and it's not in my head the way it is with the other speakers, so I will be relying on my papers a bit. And let's see, I'm not sure. Just put that on somewhere. Okay. Okay, I'm going over, no, here. No, you have to stay here. Right here. Okay. Okay. Well, I can also look at this, but that's easier. So here's the list of propositions, and the next page will be a list of measures. And these propositions, they have all 7 have been decided as of yesterday evening at 8:17. And there are 4 no's and 3 yeses, and it's kind of interesting where how the yeses and the no's came about, at least a couple of them, and they had to do with Gavin Newsom, who was a strong proponent of Proposition 1, which is the choice, allowing women to make choices about their bodies. And he came out strong with that one. And we already had measures in place allowing for women to have an abortion before, I think it's 24 weeks, unless there was a health issue involved. And now that will be in the California Constitution, and it'll be much stronger than it was. Then, and I can say more about that soon. Proposition 26 and 27. We discussed, by the way, we discussed all these propositions at length, pros and cons. Was it October 16th at our previous meeting? And the video for that is available on YouTube, which I watched again last night. And so if you want detailed information about the propositions, that's where you can find it. And Marla, who presented 26 and 27, gave us quite a bit of history and insight into these 2 propositions. In any case, they're both about betting. And let's see, Prop 26, gambling legalizes sports betting at Native American gaming casinos and licensed racetracks. Prop 27, also about gambling, legalizes online/mobile sports betting outside of tribal lands. Obviously, there was a lot of controversy about these 2. They have both been voted down. And let's see.
I forgot to mention that for Proposition 1, see, it got 65.7% of the vote. 26 was voted down by 69.4%. And by the way, 69 and 68% of the voters have voted on these measures. Yes.
It's really interesting reading on 27. You can see accounting, one and one film, and for 26 and 27.
Yes.
Yes.
Yes. Well, I was very surprised because a friend of mine is the recently retired director of the Indian Education Center here in town. And I thought that she might support 26, but she was down on both of those. But that's just one person. Anyway, so Prop 27, where'd it go? Legalizes I said this, legalizes online mobile sports betting outside of tribal lands. 27 lost by 83.2%. So that's a big loss with 69% of the votes in. Prop 28, which was the art funding for art and music and the arts. There wasn't a lot of controversy about this proposition, and it passed with flying colors. Well, pretty flying. 62.4% out of 69% of the voters. And let's see, and I forgot to mention about Prop 26 and 27. There was heavy funding from outside of the state for this and inside of the state. Did I move out of, I'm moving around. And the total was a funding for and against these two betting gambling propositions approached $500 million. And I can imagine better places for that money to go. Then.
And they are coming back.
Oh, yes. Oh, yes, we will see them again. There are some incredibly wealthy interests. I think there were 10 companies that were outside. The number 10 rings a bell. I think 10 companies had to put in money to get in on 27. But anyway, a number of companies outside of California supported 27. And it was just, it's all about money. Huge amounts of money are involved here. The controversy had to do with many areas, whether it was going to take away from the tribal incomes, whether it was going to allow lawsuits. I guess that was 26, allowing lawsuits of the tribes for the card rooms. There are many card rooms around this state. We have 2 here. And what else was there? Oh, kids getting involved with gambling and gambling addiction. So these were some of the issues that came up with this, although it was pointed out that young people are already gambling online. So regulations on that are pretty lax. Then Proposition 29, healthcare, and this was the third iteration of this kind of an issue, trying to get specific professionals to monitor dialysis in dialysis centers. And the professionals are medical professionals, whether it's an R, I don't remember actually whether it needed to be a specially trained physician or a specially trained nurse, but it was someone who had to be specially trained to monitor these things. Apparently there are infections in the tubes that provide the dialysis, and this is the third go round for a measure like this. And again, they were defeated. 58.7% voted not to increase in, oh, sorry, I'm looking at the wrong one. 69.7 voted to not enact those requirements for having a special staff person. And part of the problem too was they had, is this right, about fewer than half of the people that were needed if this measure went into effect. They just didn't have the people.
And you were afraid to be taken away from hospitals that have more clients.
Right, especially with COVID and other things that are happening in this country. And so that was defeated, but the supporters were some of the unions, and the fact that it's a third iteration, it is thought that these unions are trying to kind of get a distraction on into the making it really difficult for hospitals and medical centers, because they want to use them, unionize them more than they are right now. Prop 30. This was another one where Gavin Newsom came down hard against it. And that seemed like an anomaly, since California is very pro-environmental and very pro kind of taxing the wealthy. This is the one that would tax people who earned more than $2 million, either as a single or as a couple. And they would be taxed additionally, and it would go to making it, enabling more zero emissions vehicles and cleaning up the environment. And you'd think, being California, that we would go for this, but Gavin Newsom came down hard. Yes, Marla.
Well, I was on the, so they covered
Yes. Yes.
was against it, and I staff huge times, several times actually, the California Democratic Party work hotline. And this was one of the, like, for the day that this was one of the common questions we got, the guy got, and while I was speaking, how this line with the Democratic Party, does to support Prop 30, but I know this is no, and then sort of say, well, they have different views of the proposition and whether it's the way to accomplish the purposes of it, and something kind of explained. It was interesting because it was, and the people generally said, well, the government is the sense I'm doing. So it is
and that was consistent with what I was reading. Other points of confusion for that proposition were that schools and educational systems were opposed to it because it was so loosely written that they were afraid that monies that they normally get, that they depend on, would be rechanneled over to environmental and zero emissions vehicles and that entire area. It wasn't really clear. And because it wasn't clear, and Newsom was in there and people wondered why, there were points of confusion about that. And let's see, I got a couple of quotes here somewhere. And yeah. Hang on. Okay. This should, nope, that's not it.
also some concern I think it would be fun, you see that if you put taxes on local people, that it might increase them moving out of the area.
Yes. And we depend on their taxes. In fact, some incredible percentage of our taxes comes from that population. And there have already been losses to Texas and what is it, Arizona? Florida, thank you. And I know a little bit of it is in Georgia too. So let's see. No, I'm not finding it.
It's keep going.
Yeah, we'll keep going. Onward. Okay. Well, I can't do this quote, but the essence of it was that a really good way to get voters to vote no is to have it measures or propositions that are written in a confusing way, because people will say, take the lesser of two evils, and they would rather vote no and not have a catastrophe if they can't understand it. And that was the case with 30. I would imagine it was true for 26 and 27 too. There were what, 30 pages of materials for those. Okay, measure D.
Nope.
No, Proposition 31.
Oh, sorry. I should know that. That's what I presented previously. So the referendum for Prop 31 is actually a referendum to uphold SB 793, which passed, I guess, the last election, but there was a referendum petition by the tobacco companies, and this SB 793 bans the sale of flavored tobacco products, and there are just dozens and dozens of flavors. Here in Livermore, we have banned the sale to people under, 18 for a number of years, and we were, I believe, the second city in the country to do so. So we can pat ourselves on the back, but then we have to keep fighting to make sure that is sustained. And so 33 would ban the sale completely of flavored tobacco products, with a few exceptions, certain pipe tobacco and certain cigars and premium tobacco. And let's see. So if you vote for 31, it would uphold 793. If you vote against it, it would repeal the flavored tobacco ban. And as you can imagine, the chief supporters of 31 were the tobacco companies like R.J. Reynolds. There was a bizarre match company that was supporting it, but all of the tobacco companies, and they put money in the first couple of times when this was being voted on, and there was less money this time, but still plenty. Everybody who voted, who was support against tobacco flavor, included people who included all the healthcare providers, school districts, lots of people who cared about their kids. And so the vote is 62.8 in favor of banning flavored tobacco. 62.8 of the percent of the vote, and 69% of the vote is in. 37.2 wanted to repeal the tobacco ban, and so they are losing, and we are happy.
Okay, so for that one, so this was the delaying tactics of those companies. So the minute they declared the laws, they actually sued California. So it's kind of,
yeah, they held off 793 for a certain amount of time, and during that time they were earning money because the ban was not in effect. So they earned what, millions, billions by delaying and getting that referendum. Any questions? I've got material. Any questions?
While Mary, this was just a report. So let's just keep that. Details?
Oh, I keep forgetting. All right. D. You already have it. Okay. Well, measure D would enable, as it says, expansions of wine production and equestrian facilities. Right now, there is a measure or a law that says you cannot expand. You can have only a limited amount of. Here we go. So for measure D, it would continue to prohibit uncontrolled development in designated protected open space and agricultural areas. And yes, there would be equestrian facilities. They would have more wine tasting facilities and possibly some conference centers, but they would not violate the limits set by the 2000 Measure D initiative. And as you can see, it is winning 68.17%. And so they have exceeded what they need to win. And so that is, I guess, decided. Then measure G, school bond measure to upgrade classrooms and facilities with independent audit. It's a very close race. The vote. Well, oh, wait a minute. Yeah. Okay. So what they wanted to do was issue $450 million in bonds, levy a property tax of about 6 cents per $100 assessed value with no exemptions for seniors like me. I voted for this, but it kind of hurt. And upgrade classrooms, training facilities. Some of them are as old as 60 years old. There are a whole lot of portables in this town that should have been upgraded many years ago. Improve safety, security, repair, replace deteriorating facilities, keep instructional technology up to date. I'm sure that's changing all the time. And support STEM instruction. They don't say it in here, but I would think that HVAC is also pretty important here. I see Christy nodding her head. Provide independent oversight and audits, not fund administrator salaries, allow the district to compete for matching state funds, and it's been defeated. So that means that property taxes will remain the same and our facilities will continue to deteriorate unless some other measure is written. Right, that's G, and that's too bad. Sad news for several people in this room. Measure P, that was a shoo-in also. A yes vote would allow, what do we have here? It amends the South Livermore plan and the urban growth boundary policies and extends the sewer down over to Tesla Road and I believe up towards Greenville. And let's see. And it extends the sewer service to permitted uses within the South Livermore Valley area planning area. And this is because right now, what they've got is septic systems, and these are leaky septic systems from nearby unincorporated homes and from whatever is in that area that doesn't have or an actual sewer service. And so the no vote would mean that there would be no change and no sewer extension services. But We have, yes. And so they are winning. Okay, questions? I think that's it.
Well, since you mentioned the senior waiver, can you just explain why not? It was not the big pushback from the senior.
This is Christy Wong. She's a school board member.
It's where it's not allowed to offer that. It's within the.
So what alternatives are there now?
There is none.
There are none. Offer it again in 2 years.
Yeah,
No, offer it again and again and again until it passes.
Because what people don't understand is some schools are so bad, they are having like big roofs and walls. It's not where kids can, slide. So it needs to be done.
Well, there was,
Measure is the only way by state law that are allowed to raise money for facilities. People leave their whole school, about 25 days to manage their money better. They don't understand that it's a pot, this and a pot, and this and a pot, and this. And if you can only fill the facility this way, there is no other way.
and there is monitoring to make sure those pots don't leak.
And they thought, we have to, they thought they were saying, here, this is what we. So what's the whole part go out and find money? We do that for you. You think life is something? Because one of the ways, yeah. I don't actually talk to my other conversations. How are you understanding that? Is there a plan for? So what are you thinking about? Yeah. There will be others website. To the ultimate, you need to put a school in the environment. Really, more about it. Also online. It's very deep on the first part, missing also. And it's only but it's made on strategy. The main reason he was language, he just kind of say for reasons, but he was ignored by the local makers or local language. So he's based on that. I don't want
One of the One of the sort of ancillary concerns about this is when you have these deteriorating facilities, it can be injurious to the people who use them. There was a description of tennis courts with weeds growing in the cracks. There was a narrative of a teacher sitting in a circle. I don't think she was in our district, but it's the sort of thing that can happen. Sitting in a circle with her young students, a learning circle, and the ceiling fell on her and she was injured. And that's lawsuit country. So maybe we're saving money now, but it could easily head south in a bad way if there are injuries.
Even before getting to that, the money then entertaining facilities is part of and used for housing other things that don't work and the cost of maintaining and using. When my kids were going in. They couldn't use the pools because of the market outside. So we're having to pay for a pool at the school. And one kids couldn't not do what was in the conference. And they implemented on me. And so people want to say, providing facilities for your. We did go on the time when we rendered but this facility is going to be used.
Anyway, so, any more questions? Okay, well. That concludes it. Except for the team. If one announcement, from, any on Senate. Well, that's one, the first. Okay. But stay, don't leave, because there are others.
Okay, so one thing we have, we're thinking about doing for December for our general meeting is to have enjoy ourselves after the long effort for the election and have a holiday party. And we're thinking of having it at the Big White House winery here in Livermore. Plans aren't finalized yet, but that's in the offing, we hope. So another announcement.
The meeting in January will be the third Wednesday instead of Sunday, whatever today, the third Sunday instead of the second Sunday, because the first second one is pretty tough. And more people will recover. Will that third Sunday be going forward or just the one? Probably. I haven't. Okay, never yet. For time. And the date for the Christmas party?
That would be, I think, the 11th. That's the normal second Sunday of the month. While we're together here, we have a couple of new people. We'd be interested in hearing what kind of topics you might want us to cover in the future. Yeah, they've been here before. Okay. A question. No topics that you have in mind? Okay. So that's good. All right. Well, thank you very much for attending, those here and on Zoom.
What?
Well, okay. Yoko, go ahead.
So the other Indivisible, Georgia on December 6th, election to be elected forum is a big deal. Postcarding, texting, phone banking, and the details will be sent to everybody later. Also, the hearing vote in Arizona, Nevada, and California are ongoing. So if you don't mind to make polls, as well as actually going there and knocking doors, because these voters are not educated voters. So we're gonna make polls and following up by the door knocking. So they are asking for the canvassers as well. And then we had a national call last Thursday, and they are talking about the rest of the year. So normally they just go into the lambda or whatever. They just don't do any job. But it's likely we're gonna lose house. Then the debt ceiling will be a problem again. But using a reconciliation, we can actually do that during this year when we still have a majority. So we want to push our Congress members, both senators and our congressmen as well. So please make call. And the rest of the stuff, whatever we can push, we want them to push. Because next year we cannot do a lot of things. And one of the things we really need is just to keep putting things on the record. So the difference between the Republicans and Democrats are very, very visible, and we can use it against them in 2024. So that's very critical. So our work is not done yet. And probably about by Wednesday, most of the local election results are coming in, as well as the most of the California results are coming in. So we will keep an eye on that, and Facebook or the emails, we will inform everybody. Thank you so much.
Thank you.